Organizations also have to move on from this idea that we're supposed to solve the problem individually, that we should be dealing with this. Oh, yes, you should just, individual resilience, why don't you go and do, go take a run or, meditate, et cetera. All these things are really good, these individual resilience training. But well, what about the organization, first of all, providing actual support? There's only so much we can do without either burning out or also, giving unsafe care. And I
Right.
think organizations have to really wake up and say, we have responsibility for creating safe work environments.
Imagining Healthcare with Medplace. It's a new dialogue with risk and safety leaders. If you find value in today's podcast, please share and subscribe. If you're interested in being a guest speaker with Medplace, you can reach us at speakers@medplace.com. Also, check out our related content for videos and articles. Last time we were joined by Dr. Mark Grenewald, where we discussed physician well-being through his technology platform, Peer RX Med Program. Today, I'm joined by Dr. Jo Shapiro. She is an associate professor of otolaryngology, head and neck surgery for my non-medical listeners, at Harvard Medical School. She's also a leader in the effort for peer support, which I've had an opportunity to talk with you a little bit about that, Dr. Shapiro. I'm very passionate about this, and I am also, as you know, very concerned about the mental health well-being of our healthcare providers. So I'm really excited to have you here today. Welcome.
Thank you so much for having me.
Great. It looks like I've got a couple of questions, and like I said, I hope we get to all of them. But knowing you and I, how I've met you already, we may go off tangent with that. That's okay. But with over 20 years experience that you've got in hospital leadership as well as at Harvard Medical School, you've been a driving force in peer support for physicians. So can you tell us a little bit about your career and what led you to understand the importance of this topic and what it means for physicians, and really a little bit about what you and I talked about previously, how that translates to healthcare for those of us that are consumers?
Well, thanks for asking. I do want to make sure I'm always very inclusive about this being important for physicians for sure, and not just physicians. That those of us providing healthcare, these kinds of issues affect everybody.
Yeah,
So just want to make sure.
good
Although
point.
sometimes the studies are done about physicians, and we certainly are definitely in need of support and care, as our colleagues in the team. Yeah, so I'm a surgeon, and I practiced clinical medicine, surgery for over 35 years, and I had the honor of having a fair amount of different kinds of leadership positions. Um, uh, Previously, including being division chief at Brigham and Women's Hospital in otolaryngology, but also one of the leaders in graduate medical education for which is residency and fellowship for all of Mass General and Brigham hospitals and affiliates, and being a practicing clinician. In those positions, I just saw so much suffering, and
Yeah.
when I say suffering, I mean actually suffering on the part of the people who are doing the work, taking care of patients, training others to do so, researching, just a lot of suffering. And I thought, you know what? We've not, as a profession, paid almost any attention to that. And if we're suffering, first of all, it makes our careers not sustainable, but also it's going to translate into our giving not as good care as we could to our patients. And I really wanted to be a part of, at an organizational level, of actually doing things that would improve the well-being of those of us in healthcare.
Wow. I had chatted with you briefly prior to this podcast, and one thing that I noticed very early in my career as a medical ICU nurse, and I'm talking early 90s, right? I noticed some very concerning lack of well-being, for lack of a better word, amongst physicians and nurses, especially. And I thought to myself, new in my career, I thought this isn't sustainable. And back then, there was not a lot of talk about peer support for nurses or physicians or really anyone in healthcare. I mean,
Mm.
you did what you did and did what you were told, and you've got all of these things. Um, how do you think peer support has changed with the COVID pandemic as well as post-COVID pandemic? Like, where are we now in regards to peer support and hospitals and physicians and nurses really even understanding what this is, and do we need to implement it within our hospital? Like, can you tell us where you think we are and where we need to be, maybe even?
Yes, I think it's a great question. And I would step back and say, peer support is a well-being program, essentially, a well-being intervention, a way to improve well-being. But of course, it's not the only one. So these things have obviously grown in parallel. And I think, as you know, from our past years in mind, that we certainly that this wasn't in anyone's consciousness that there was an issue of our well-being. So I think that had to happen first in some ways for people to wake up and say, this is a problem. And to your point, we grew up in a culture that did not think that our needs were worth meeting. And I kind of bought that too. I mean, I think I drank the Kool-Aid because we thought, well, we're in a healing profession and we're supposed to be altruistic. And that means always putting other people's needs above our own, which, in the moment, of course, yes, that of course we do, right? Our patients
Yeah,
come first, right?
yeah,
Or our families, for sure. But always, never, ever, ever processing our own emotions and also recognizing our own humanity, and that because we are human and because we're so committed and caring and compassionate, we are going to have suffering. We see suffering and things go wrong and there's lots of stressors. And so, there wasn't a consciousness that actually our suffering unattended to might translate into suffering of the very things that we want to have happen, which is great care, great education, et cetera. And so I think there needed to be, and this happened for me in parallel, was when I proposed starting the Center for Professionalism and Peer Support in 2008 and I wanted to do it at the Brigham and Women's Hospital, which is where I was also working clinically, um, is, let's think of some, multiple efforts to support well-being, one of which is peer support. So now to your specific question about, so where are we at? And I think we would recognize that we're down the road a bit from the well-being, lack of any thought that it was important to. I think there's so much data now by some great researchers who have shown this is a thing. It's
yeah.
quite prevalent and it's devastating in many ways, and it can lead to very devastating consequences. So I think that's been incredibly helpful. And as you know, there's been a sea change of people saying, "Oh gosh, we do have a problem." So then it comes to, all right, how do we solve in what ways can we address the problem? I don't think it's a quick solution, nor do I think it's a
Right.
solution that we're used to, like, I'll take out your Zinkers and you won't have any swallowing problems anymore. This is not that kind of problem.
Yeah.
So many, many people have been working on different well-being efforts, and they're unique and different and interesting, and they deal with different aspects of things that drive burnout. And on the other side of the coin, drain well-being. So peer support, when we first thought of it, it was incredibly countercultural, incredibly, because
Wow.
for the reasons you say, we were taught, first of all, we shouldn't be suffering anyway, so why would you need
Yeah.
support? So that's one. And the second is, even if you're suffering, you really need to walk it off. You really just need to deal with it yourself. And we have a big culture in medicine, a culture of silence. You aren't supposed to have any mental health issues, no less physical ones, and you certainly weren't supposed to have any sort of work-related pain from the things that happen at work in medicine. So I think that's when we started peer support. We were very much in that culture. Um, and the other part of that culture that I think was so um, I was going to say evil. It sounds a little extreme, but really just so counterproductive was this idea that any support any self-care and any community organizational support was weak, a sign of weakness. Needing
Mhm.
that was a sign of weakness. And so, the last thing we want in our profession is to look weak. Like, we should be able to tolerate this suffering. So I think people get that, that's just so counterproductive, and understand, at least intellectually, that self-care is not selfish. That said, we're still in that culture to some degree. It's not like we had a memo. I say this when I do give talks about peer support. You can't change the culture by saying, "Oh, we don't do that anymore." Like, self-care is no longer selfish, right?
Yeah.
Culture change happens. It can happen in big leaps, but it doesn't happen by telling people this kind of culture is dysfunctional. I mean, that's part of it, but then what are you going to substitute it with? So I think we have to recognize, and answer to your question, that we still have a culture of where we equate strength with lack of vulnerability. In fact, while we really know, and there are lots of people who write beautifully about this, that vulnerability is strength, we're
Mhm.
still in a culture that doesn't really believe that. So there's still stigma to needing and wanting and accessing help. Okay, that said, I think the stigma is getting better. I think also the structural barriers to getting help are being lifted little by little by little. Then you have all of this background, and we started peer support, at least when I was at the Brigham, and then have helped over 100 organizations start their own peer support programs. Um, Plenty of that was done before the pandemic, so we were making progress, right? Then you have the pandemic, and the first thing that happened is all attention goes to patients with COVID,
Sure.
basically, as it should, right? But a lot of people have now written about the fallout for healthcare professionals, including a colleague of mine and I wrote a piece for the New England Journal about this is going to have a huge effect. And so,
Yeah.
what are we going to do about it? How are we going to help decrease the what we thought would happen, which is a lot of more mental health issues and burnout issues, which are not necessarily related to mental health.
Right.
And so I think, so we had that. So many people, some people actually were motivated during the pandemic to say, now we really need peer support," which was true. But others were like, we can't even, we have to. But I think coming out of it, people realize, like, okay, no, we can't. We've got it. Now we have healthcare providers who are absolutely burnt out, from all the reasons they were before. And now you add all the suffering and all the what's been expected of healthcare providers, et cetera, and it's pretty awful to see. So I think what we are in now is people realizing we've got to pay attention to taking care of each other. And the reason we started peer support, um, in addition to being supportive of professional mental health resources, right? That's really important. In addition to looking at workflow issues, all those things that many brilliant people are working on, those are all important.
Mhm.
And this came out of a study we did. We also knew that in the face of especially some of the acute stressors that we experience, like errors, like patient aggression, like being named in litigation, and then the chronic sort of subacute stressors like COVID, racism, harassment, all the other, there's lots of other things that
Yeah.
we face, that we need, with the stigma of getting help, that we needed to structure a program that made getting help easy. And our study showed that in addition to that, there were barriers to seeking help, and this happened to be a physician study, what physicians wanted after an acute event like an error was they wanted help from a peer, a physician
Mhm.
colleague, even though, we have great mental health practitioners. So I think, that's where that was the genesis of actually establishing a program that says, let's make this support, first of all, the kind of support that the studies show that healthcare providers want. That is, I don't need a, behavioral health person necessarily in this moment. I
Right.
need someone who's been there, who gets it. Oh my gosh, I know exactly.
Sure.
Yes, this is really painful, and will help the person navigate that stress, strategize, and hopefully come through it with some wisdom and growth versus being crushed by it. So that's the genesis. And I think, from and I don't think we have a direct study to answer your question, but I think we are at the place where people are seeing that there's such a need for various types of support, that there's even increasing openness to doing this. So I think we're
Yeah.
better off, but it's hard to measure that
Yeah.
culture change.
Yeah, that's good to hear, though, that we are, even if it's anecdotal, because I will tell you some of the nursing research that talks about violence in the workforce and just bad work environments, that it does affect patient care. So, right, so there's no reason for us to assume that the burnout and everything that's happening with physicians as well can affect patient care. And that's important for all of us as healthcare consumers to understand. Look, this is a collaborative, collective effort, if you will, to understand that just being more open. You mentioned about there's still some stigma with people being able to show vulnerability, but we are getting better as a society. But just the overall arching theme of the importance of being able to be in a safe space where you can chat with a colleague, like, look, this is really stressing me out. I think that's important because, as you said, then you're not crushed by the events that are going on around you, which burnout, right? You're leaving a profession, you're looking for something non-clinical, and then who's going to be left to take care of you and I and our family and friends and all of that? I mean, it's hugely important.
Yes, and I think you raise a really important point, which is, when we were first thinking about well-being of physicians and other healthcare providers, we felt a little awkward about it because we were like, are people going to just think we're whining? I mean, we're very privileged. So there's no question about it. I mean, I think being in healthcare is just an incredible privilege, because we are healers, which I just think is like one of the most beautiful things to be able to be in a position to do. And so we were really worried, I think, when we thought about, well, how's this going to seem to our patients, to society? Are they going to be like, oh my gosh, I can't believe these people are whining? And I think, all you have to do is look at the data to say that these things that are hurting us and that are causing our suffering as healthcare providers are very real. They're very intense, right? They're
Yeah,
unlike what most other professions have to deal with. And with the pandemic and with the shortage of, with people leaving the profession, et cetera, but with the shortage of resources, et cetera, we have a problem here. And that shortage of resources and personnel, et cetera, is then causing further burnout because of the stress it puts on those
right.
who are doing the work. And this is I mean, I hope that society sees this as incredibly important.